You know what? I see this all the time in clinical practice. An older woman comes in, points down at her ankles, and says, "Look at this. My ankles are so swollen, I can't even wear my regular shoes anymore." And immediately, there's this worry in her eyes. Is it my heart? Is it serious? Should I be concerned? And here's the thing, swollen ankles, or what we call peripheral edema in the medical world, is one of those symptoms that can mean a dozen different things. It's like a check engine light in your car. It tells you something's up, but you need to pop the hood to figure out exactly what. Today, we're going to break down two of the most common culprits behind swollen ankles in older women: heart failure and poor circulation. We're going to talk about how to tell them apart, what's actually happening inside your body, and most importantly, when you should be seriously concerned. So let's dive in. First things first, what causes ankle swelling? Before we get into the heart failure versus circulation debate, let's talk about what swelling actually is. When you see your ankles puffed up like marshmallows, what you're seeing is excess fluid that's accumulated in the tissues. We call this edema. Now, your body is constantly managing fluid balance. Your heart pumps blood throughout your body, delivering oxygen and nutrients. Your veins bring that blood back to your heart. Your lymphatic system helps drain excess fluid from your tissues. It's this beautiful, coordinated system that usually works flawlessly. But when one part of the system starts to falter, fluid can start pooling in places it shouldn't. And because of gravity, that fluid tends to settle in the lowest parts of your body. When you're standing or sitting, that's your ankles and feet. Think about it like a drainage system in a building. When everything's working properly, water flows through the pipes, goes where it needs to go, and drains away. But if there's a blockage, or if the pump isn't strong enough, water starts backing up and pooling in the basement. Understanding heart failure. It's not what you think. Let's tackle heart failure first, because I think there's a lot of misunderstanding about what this term actually means. When people hear heart failure, they often imagine their heart suddenly stopping, but that's not what it means at all. Heart failure doesn't mean your heart has failed or stopped working. It means your heart isn't pumping as efficiently as it should be. It's struggling to keep up with your body's demands. Think of your heart as a pump, because that's literally what it is. A healthy heart is like a powerful water pump that moves water efficiently through a system. Heart failure is like that same pump starting to weaken. It's still working, it's still pumping, but it's not as strong as it used to be. It can't move the volume of fluid it needs to move. There are actually two main types of heart failure, and this is important because they cause swelling through slightly different mechanisms. Systolic heart failure is when the heart muscle becomes weak and can't contract forcefully enough to pump blood out effectively. Diastolic heart failure is when the heart muscle becomes stiff and can't relax properly to fill with blood between beats. Both types can lead to something called congestive heart failure, where fluid backs up in your system. And this is where the swelling comes in. How heart failure causes swollen ankles. Here's what happens. When your heart can't pump effectively, blood starts backing up in your veins. It's like traffic on a highway. When cars aren't moving through efficiently, they start backing up and creating congestion. As blood backs up in your veins, pressure builds up in those vessels. This increased pressure forces fluid out of your blood vessels and into the surrounding tissues. That's your swelling. But here's what's really fascinating. Your body tries to compensate. Your kidneys sense that blood isn't flowing through them as well as it should, and they think, oh no, we must be dehydrated. We need to hold on to more fluid and salt. So they start retaining fluid, which only makes the swelling worse. It's like your body is trying to solve a problem, but it's actually making the problem bigger. Your heart is already struggling to move the fluid it has, and now your kidneys are adding more fluid to the system. The swelling from heart failure typically follows a very specific pattern. It usually starts in both ankles and feet, and it's symmetrical, meaning both sides look about the same. As it gets worse, the swelling can creep up your legs to your calves and even your thighs. The red flags of heart failure. Swelling now. Here's what's really important. Swelling from heart failure rarely comes alone. It brings friends to the party. If your swollen ankles are caused by heart failure, you'll usually notice other symptoms too. You might feel short of breath, especially when lying flat. That's why many people with heart failure need to sleep propped up on multiple pillows or even in a recliner. You might notice that you're waking up at night gasping for air or needing to urinate frequently at night. You might feel unusually tired or notice that your exercise tolerance has decreased. Activities that were once easy now leave you winded. You might gain weight rapidly, like several pounds in just a few days, because of all that fluid retention. And you might notice swelling not just in your ankles, but also in your abdomen. These additional symptoms are your body's way of telling you that this isn't just a simple circulation issue. This is something that needs attention. Now let's talk about poor circulation. Poor circulation is a completely different animal, even though it can cause similar-looking swelling. When we talk about poor circulation in the context of swollen ankles, we're usually talking about something called chronic venous insufficiency. This is when the veins in your legs aren't working properly to push blood back up to your heart. See, the veins in your legs have a tough job. They need to push blood upward against gravity all day long. They do this using a series of one-way valves that act like little gates, preventing blood from flowing backward. Imagine climbing a ladder with trapdoors at each rung. You step up, the trapdoor closes beneath you, and you can't fall back down. That's how these valves work in your veins. But over time, these valves can become damaged or weakened. When that happens, blood starts flowing backward and pooling in your legs. The medical term for this is venous reflux. Why do these valves fail? There are several reasons these valves can become damaged. Age is a big one. Like everything else in our bodies, these valves can wear out over time. Pregnancy can stress the veins and damage valves. Standing or sitting for long periods puts constant pressure on these valves. Previous blood clots can damage the valves permanently. Being overweight increases pressure in the veins. And here's something interesting. Women are more likely to develop venous insufficiency than men, partly because of hormonal factors and partly because of pregnancy. How poor circulation causes swelling. When blood pools in your legs because of faulty valves, pressure builds up in those veins. Just like with heart failure, this increased pressure forces fluid out of the blood vessels and into the surrounding tissues. But the mechanism is different. In heart failure, the problem starts with the heart not pumping effectively, and the backup affects your entire circulatory system. In venous insufficiency, the problem is localized to your legs. Your heart is pumping fine, but the blood isn't making it back to your heart efficiently. The telltale signs of circulation-related swelling. Swelling from poor circulation has its own characteristics. It typically gets worse as the day goes on. You might wake up with minimal swelling, but by evening, your ankles look like they belong to someone else. The swelling often improves when you elevate your legs or when you wake up in the morning after lying flat all night. That's because elevation helps gravity work for you instead of against you, helping the blood flow back toward your heart. You might notice skin changes too. The skin on your lower legs might become discolored, taking on a brownish or reddish tint. You might develop varicose veins, those twisted, enlarged veins that are visible under the skin. Your skin might feel itchy or appear shiny and tight. In severe cases, you might even develop skin ulcers near your ankles. And here's a big difference. With pure venous insufficiency, you typically won't have the shortness of breath or the nighttime breathing problems that come with heart failure. Your lungs are fine. Your heart is fine. The problem is strictly in the plumbing of your legs. So, how do you tell them apart? This is the million-dollar question, right? Because from the outside, swollen ankles can look pretty similar, whether they're caused by heart failure or poor circulation. Here are the key differences to look for. Timing matters. Heart failure swelling tends to be relatively constant throughout the day, though it might be slightly worse in the evening. Circulation-related swelling is dramatically worse at the end of the day and much better in the morning. Location matters. Heart failure swelling is almost always bilateral and symmetrical, both legs, both ankles, looking about the same. Venous insufficiency can be bilateral too, but it's often worse on one side, and it might not affect both legs equally if the valve damage is worse on one side. Associated symptoms matter. This is huge. If you have shortness of breath, especially when lying flat, that points toward heart failure. If you have chest discomfort or excessive fatigue out of proportion to the swelling, that's concerning for heart failure. If you're waking up gasping for air, that's really concerning for heart failure. On the other hand, if you have skin changes, visible varicose veins, or if the swelling responds dramatically to elevation, that points more toward venous insufficiency. The pitting test. Here's something doctors do. They press firmly on the swollen area with their finger for about 5 seconds, then let go. If there's an indentation left behind, like pressing into Play-Doh, that's called pitting edema. Both heart failure and venous insufficiency can cause pitting edema, but the quality and duration of the pitting can differ. But wait, there's a plot twist. Here's where things get complicated. You can have both conditions at the same time. In fact, this is pretty common in older adults. You might have mild heart failure that's well controlled with medication, and also have chronic venous insufficiency from years of standing or from pregnancies decades ago. In this case, both conditions are contributing to your swelling, and treating just one won't completely solve the problem. This is why accurate diagnosis is so important. You need to know what you're dealing with so you can treat it appropriately. Other causes we haven't talked about. Before we wrap up, I want to mention that heart failure and poor circulation aren't the only causes of swollen ankles. There are several other possibilities that shouldn't be ignored. Kidney disease can cause swelling because your kidneys aren't filtering and excreting fluid properly. Liver disease can cause swelling by affecting protein levels in your blood. Certain medications, especially blood pressure medications like calcium channel blockers, can cause ankle swelling as a side effect. Lymphedema, a problem with your lymphatic system, can cause swelling. Blood clots in the legs, deep vein thrombosis, can cause sudden, one-sided swelling and are a medical emergency. So while we've focused on heart failure and circulation issues, it's important to keep an open mind about other possibilities. When should you actually worry? Let me be really clear about this. Any new or sudden swelling deserves medical attention, but certain red flags should send you to the doctor immediately. Seek immediate medical care if your swelling comes on suddenly, especially if it's just one leg. That could be a blood clot. If you have chest pain, severe shortness of breath, or you're feeling like you might pass out, that could be a heart emergency. If you develop sudden swelling with pain and warmth in your leg, that could be a clot or infection. If you notice your swelling is getting progressively worse over days or weeks, despite trying home remedies, you need professional evaluation. Even if none of these red flags apply, persistent ankle swelling that's new for you should be evaluated by a healthcare provider. They can perform appropriate tests, blood work, heart ultrasounds, venous studies to figure out exactly what's causing your swelling. The bottom line. So, swollen ankles in older women, heart failure, or just poor circulation? The truth is, it could be either, it could be both, or it could be something else entirely. Heart failure swelling tends to be bilateral, relatively constant, and accompanied by other symptoms like shortness of breath and fatigue. Poor circulation swelling tends to worsen throughout the day, improve with elevation, and come with skin changes. But here's what I really want you to take away from this. Swollen ankles are your body's way of telling you something isn't working right. It's a symptom that deserves attention and proper evaluation. Don't ignore it. Don't assume it's just a normal part of aging, and don't try to self-diagnose based on an internet video, even this one. See your doctor. Get a proper evaluation, because whether it's your heart, your circulation, or something else entirely, there are treatments available that can help. And the earlier you catch these problems, the better the outcomes tend to be. Your ankles are trying to tell you something. Listen to them and get the help you need to figure out what they're saying. Thanks for reading, and take care of those ankles.